Okay.
Chapter 19, Part 3, page 399. Automated Supply Replenishment Systems. Automated supply replenishment systems use a computerized system to gather and track the issuing of patient items. PAR and reorder levels for each item are established. Clinical staff scan or push a button to account for each item removed from inventory location. An order is generated at a scheduled time for all items that are at or below their pre-order point, and the order for the entire location is then placed. The supply pick list is printed and is used to gather replacement products to refill the unit. Automated systems are generally interfaced with the healthcare facility's material management system for managing inventory. The use of these interfaces reduces the amount of staff required to perform these functions. Definitions: automated supply replenishment system. Replenishment system in which items removed from inventory are automatically identified and tracked. When a reorder point is reached, item information is generated on a supply pick list in the central storeroom or with a contracted vendor. Items are then issued and transferred to the appropriate user area. Definition: interfaced. An area or system through which one machine is connected to another machine in order to share information. For example, two computers may be interfaced, or a computer and a sterilizer may be interfaced. Benefits of automated systems relate to the facility's size and the number of items being monitored. These systems are expensive and may not be cost justified for all or some of the remote storage locations. Figure 19.11 provides examples of equipment used in an automated system. Exchange cart systems. An exchange cart system is an inventory replenishment method that involves the exchange of a freshly filled cart on a user unit. Supply items and quantities on the exchange cart, as well as its location, are determined by user unit staff and the CRCST materials management personnel. At a predetermined time, a full cart is brought to the unit. The partially depleted cart is returned to the replenishment area, and remaining items are inventoried to determine the supplies and quantities that were used. The cart is then replenished with the supplies needed to return the cart back to the full inventory. As supplies are removed from inventory and added to the cart, they are charged to the budget of the unit that owns the cart. At the scheduled time, this full cart is delivered to the unit. The depleted cart is retrieved for restocking, stocking, and cycle repeats. Figure 19.12 provides an example of exchange carts that are designed to stock anesthesia supplies. An advantage of an exchange cart system is that it is automatic unless there is a need to change the cart's items or quantities. Clinical staff do not need to order these items, and material management staff does not have to determine which supplies are needed. Disadvantages associated with exchange cart includes the need for duplicate inventory and carts. The system is labor intensive and requires adequate space to stage the carts. In addition, unless the system is well managed, numerous unused supplies will be transported back and forth for each cycle. This system does not work well for emergency medical supply carts or code carts, which are exchanged for a newly restored cart each time they are used. See figure 19.13 for a code cart example. Definition: exchange cart system. An inventory system where desired inventory items are placed on a cart assigned to a specific location and quantity. A second duplicate card is maintained in another location and exchanged on a scheduled basis to ensure that sufficient supplies are available at all times. Requisition systems. Even when par, level, or exchange cart systems exist, it will still be necessary to order additional supplies. That usually happens because of insufficient quantities on hand or because a specific item is not included among those routinely provided. Requisition systems exist in every facility. Requisition systems require users to request or order need supplies by completing a requisition. Requisitions may be manual, paper-based, or computer-generated. Manual systems do not offer the productivity advantages of computerized systems. Requisition systems that electronically requisition supplies typically eliminate the need for materials management personnel to re-enter ordering information from a paper order form. The accuracy and productivity improvements associated with an automated data entry are lost when manual requisition systems are used. Figure 19.14 provides an example of a technical or a technician completing a requisition for special order catheters. Definition: requisition system. A method of inventory distribution where items needed are requested or requisitioned by user department personnel and removed from a central storage location for transport to the user department. Specialty items. Every facility has a need for patient-specific and infrequently ordered specialty items that are not maintained in the routine replenishment system. CS technicians must understand the requisition, ordering, tracking, and replenishment process used by their facility for these items. If a patient is scheduled for surgery and a specialty item is needed, it may need to be ordered several days before surgery to ensure that it is available. If an item is not available when needed, patient safety must be compromised. Last line. If an item is not available when needed, patient safety may be compromised. Case cart system. Perhaps the most common form of inventory management and distribution in the CS department is the case cart system. In a case cart system, items needed for each specific procedure are assembled in individual carts by CS staff and delivered to the department where the procedure will be performed. There are several benefits to case cart systems, including reducing the amount of space needed for supply storage in the user department, promoting more standardized infection prevention practices, reducing operational costs associated with supply and instrument management, and allowing more efficient equipment and supply tracking. Case cart systems range from those providing disposable supplies or instruments for each procedure to comprehensive systems which provide each case's instrument, supply, equipment, and implant needs. While they are most commonly used for the OR, case cart systems can be used anywhere that procedures requiring supplies and instruments are performed, including cardiac catheterization labs and labor and delivery, L&D. When implemented correctly, these systems help to meet the needs of each physician and still maintain an orderly system for tracking and handling supplies, instruments, and equipment. In a case cart system, specific needs for each procedure are identified by the user. These needs are compiled on a requisition form called a preference card or pick list. The preference card usually contains two components. The first is a list of instruments, supplies, and implants needed for the specific procedure. The second component contains notes that are helpful to the procedure staff room. When a procedure is scheduled, a copy of the list of needed items is sent to CS, and the case cart is assembled. See figure 1915. That case cart is delivered to the OR or another user unit before the procedure. Additional unanticipated needs are communicated to the CS as necessary, and CS responds to those additional requests. Following the procedure, unused, unopened, clean, and sterile items are returned to storage. Waste is separated, bagged and removed. Reusable linens, if used, are bagged. And all opened and soiled instruments are sent to the decontamination area for processing. This process is repeated multiple times throughout the day as an additional procedures are performed. See figure 19.16. Case cart systems can also provide effective control of supplies and instruments. Because a separate case cart is assembled for each individual procedure, it is easier to track what is actually used and identify supplies and instruments that are often requested but seldom used. Quantities of supplies can then be reduced, which can reduce the amount of inventory that must be on hand. Close monitoring of instrument usage allows the facility to shift instruments not being used to other areas where they are needed. Monitoring can also identify instrument shortages, which may be addressed with scheduling changes and/or the purchase of additional instrumentation. Case cart systems enhance infection prevention practices. Because all instruments are returned to the decontamination area immediately after use, decontamination and sterilization process can begin immediately. CS technicians assigned to processing in a case cart system devote most of their time and effort to preparing items for reuse. That is their primary job function, so they become specialists in cleaning, inspecting, assembling, and sterilizing complex instruments. This expertise yields better infection prevention practices. Case cart systems rely on user input to be effective. Physicians and other healthcare personnel utilizing the case cart must identify their specific needs in advance. These needs are then transferred to pick lists that the CS staff use to assemble each cart. Care should be taken when developing requisitions to ensure that products are standardized whenever possible. Routine follow-up is needed to adjust requisition quantities to actual usage. Properly stocked case carts should be delivered to the user unit. Personnel assigned to the case cart area must maintain direct contact with the unit staff so additional items can be supplied as needed. After the procedure is completed, used and reprocessable items must be returned to the decontamination area. CS technicians should return uncompromised items to stock and then proceed with inventory replenishment and charging activities. While case cart systems typically use cart assembled as needed for specific procedures, most systems also utilize some form of pre-assembled carts that remain assembled and on standby for emergency situations. These carts used for stat situations, for example, emergency cesarean sections, when there is no time for cart assembly. An effective case cart system requires good communication between OR and CS personnel. As cases are performed, CS and OR staff must be in constant communication to ensure that items are correct and arrive on time. Personnel in each department must be familiar with one another's routine duties and workflow patterns. Frustration can be eliminated if, for example, OR personnel understand the steps involved in processing instruments for another case. Instead of questioning instrument turnaround times, they will understand that this time is required for safe, effective cleaning inspection, assembly, and sterilization. CS technicians working with the case card systems should have good medical terminology skills and a thorough understanding of surgical instruments so they can easily communicate with their OR counterparts. They must also remain up to date about new products because they serve as the link between the inventory system and the user department. Along with effective oral communication skills, case card systems rely heavily on written procedures and communications. Personnel from all user departments must establish procedures for product handling, outage notification, and scheduling. Even the best planned case card system will be substandard without good communication. Case card systems also require upkeep. As instruments and supplies are added to or removed from the system, physicians' preference cards must be updated to reflect changes in the system. See Figure 19.17. Failure to update preference cards to reflect current needs can result in unavailability of supplies and instruments, which can then lead to compromised patient safety and user frustration. Case card systems require significant input from CS professionals, and to be efficient, they require a full array of processing skills and inventory management methods. Stat orders. Emergency supply orders requiring immediate action, stat orders, are a fact of life in every facility. Stat orders can also occur for a procedure scheduled for the next day if the item is not available. These orders are time-consuming and costly to fill, and they usually disrupt routine inventory management activities. Consider, for example, times when additional external resources, such as an overnight air shipment or borrowing from another facility, may be required. All reasonable efforts to minimize the need for stat requests should be made. These include reviewing why they occur and how they can be prevented. Many stat requests result from deficiencies in a poorly managed daily supply and distribution system. Stat requests can become a patient safety issue if the root cause is not addressed. The routine reviews may determine if par level adjustments will help ensure appropriate inventory levels. When stat requests result from improper planning by clinical staff, material management and CS managers should assist in the planning and education efforts to resolve the issue. While OR staff cannot predict that an emergency patient will require a specific non-stock item, they may be able to plan for such a need and ensure that the item is available. Definition: non-stock item. Items that are not carried in the central storeroom or in central service storage area, but are purchased from an outside vendor as needed and then delivered to the requesting department. Sustainability. The materials management department is also often involved in sustainability efforts. More and more healthcare facilities are taking sustainability into consideration when selecting supplies. Items that can be recycled or otherwise help reduce waste can benefit patients, healthcare facilities, and the environment. Many facilities are moving towards systems that allow them to reduce the amount of waste being generated. CS departments may be involved in those efforts. See Figure 19.18. Definition: sustainability. Process designed to reduce harm to the environment or deplete natural resources, thereby supporting long-term ecological balance. The role of central service and inventory management. Although the primary responsibilities of procurement, receiving, storage, and distribution may be performed outside the CS department, CS technicians still play an important role in the healthcare facility's inventory management system. CS technicians are responsible for several key duties, including learning the process at their specific healthcare facilities, such as how orders are placed, how to identify items, how to locate items, how to properly dispense items, knowing how to stay informed of new products as they enter the system, understanding the following information contained on commercially sterilized packages, handling sterile products with care, reporting concerns such as excessive unexpected demand on specific products, low quantities, frequent outages, and storage issues. Each step in the life cycle of a sterile medical supply is an important one. Through keen observation and best work practices, CS technicians can protect the integrity of products until they reach their point of use. Conclusion. Inventory management is an important part of every healthcare facility. Managing inventory effectively and efficiently assists caregivers in providing quality care at lower costs. More importantly, it helps ensure that the items needed to provide patient care and treatment are available when needed. When central service and material management staff work together to manage and control inventory, they help create a safe environment for the patient while increasing provider and patient satisfaction. Terms to remember: operational supplies, patient care supplies, inventory, reusable inventory, consumable inventory, capital equipment, assets, distribution, periodic automatic replenishment, PAR, automated supply replenishment system, interfaced, exchange cart system, requisition system, non-stock items, and sustainability. End of chapter 19.
Beautiful.